Take a step back in time with me. The year is 1309. We're not in a bustling marketplace or a grand palace, but somewhere far more vital. We are standing within the cool marble halls of Amasya Hospital in Anatolia, a place that would change the course of medical history. Look around. The air is thick with the scent of medicinal herbs, lavender, thyme, and something sharper, more antiseptic. The only sounds are the gentle trickle of water from a distant fountain, the rustle of paper, and the low, focused whispers of scholars. This isn't just a hospital. It's the very first medical school in Anatolia, a beacon of knowledge established just a year prior, during the Ilkhanate period. Here, under these magnificent arches, the future of medicine is being forged. Notice the columns, sturdy and timeless, symbolizing the solid foundation of science being built right here. On the walls, you see intricate diagrams and manuscripts written in Arabic and Persian, a testament to the vast web of knowledge that flows into this center of learning. In the center of the room, illuminated by the soft, flickering glow of candlelight, is a surgical table inlaid with mother of a patient lies upon it, and gathered around are a team of surgeons and their assistants. But this is no ordinary operation. Look closer. Just beyond the arches, students, both young men and women, are watching with rapt attention, their notebooks open, quills scratching furiously to capture every detail. This is coeducation in the 14th century, a revolutionary concept where knowledge is shared without gender barriers. These students are witnessing the practical application of the theories they've studied from ancient texts. Our focus is drawn to the lead surgeon. It's a woman. Her hands, steady and precise, move with a practiced grace that speaks of years of study and dedication. She is not just healing, she is teaching. Moment. Each choice of instrument from the gleaming array on the nearby table is a lesson. Her hands represent the perfect marriage of profound knowledge and masterful skill. She pauses, gesturing towards a specific point, explaining a complex technique to the eager faces watching her. Her voice is calm, a quiet authority in this sterile, serious space. What an incredible scene. We are witnessing the very essence of medical education, the direct transfer of life-saving skills from one generation to the next. The students here are not just memorizing facts. They're learning by observing, by questioning, and by seeing the human impact of their future profession. This hospital didn't just treat physical ailments. It was a comprehensive center for healing, addressing everything from surgical needs, like the one we're seeing, to mental illnesses, which were treated with music, water therapy, and compassion. Let's explore the environment that fostered such advanced learning. Through a window, you can catch a glimpse of a lush garden. This isn't just for decoration. It's a living pharmacy, a medicinal herb garden where students learn botany and pharmacology firsthand. They learn to identify plants, understand their properties, and prepare remedies. In the corner of this very room, you can see jars and bundles of these herbs, ready to be used. It's a beautiful illustration of the unity between nature and the science of healing, a core principle of the medicine practiced here. The manuscripts on the walls and in the students' hands are more than just paper and ink. They are bridges across time, carrying the wisdom of scholars like Sina and Al-Razi, whose works formed the backbone of the curriculum. The knowledge wasn't static. It was a living, breathing thing, constantly being debated, refined, and added to by the teachers and students within these walls. The act of writing, of documenting this surgery, ensures that this moment of discovery will not be lost. It will be studied by future students, perhaps in this very room, continuing the unbroken chain of medical progress. Imagine the atmosphere, the cool marble underfoot, the shadows dancing as the candles burn low. There's an intense intellectual energy, a shared sense of purpose. It's a mix of scientific curiosity and profound humanity. They are all here for one reason: to push back against illness and suffering, to understand the intricate workings of the human body, and to use that understanding to heal. The female surgeon leading this procedure is a powerful symbol. Her presence shatters our preconceived notions of the past, reminding us that the pursuit of knowledge has always attracted the brightest minds, regardless of gender. She represents the diversity and inclusivity that can accelerate scientific advancement. This hospital de Amasya Darüşşifa was a marvel of its time. It was a place where theory and practice came together in a dynamic and life-changing way, while Europe was still centuries away from establishing similar institutions on this scale. Here in Anatolia, a comprehensive system of medical training was already thriving. The curriculum was rigorous, covering anatomy, pharmacology, surgery, and internal medicine. Students would spend years learning before they were deemed ready to practice on their own. Graduation wasn't just a ceremony. It was a solemn vow to uphold the highest ethical standards of their profession. As we watched the surgeon make a final, delicate suture, a sense of calm. The most critical part of the operation is over. Her assistants begin to clean the instruments and tend to the patient. The students start to whisper among themselves, comparing notes, debating the technique they just witnessed. Their faces are alight with inspiration and the weight of their chosen path. They have just seen their textbooks come to life. They have witnessed the power of knowledge in action. The legacy of Amasya Hospital is immeasurable. It wasn't just about the patients who were healed within its walls. It was about the doctors and surgeons who were trained here, who then traveled throughout the region and beyond, carrying with them the advanced medical knowledge they had acquired. They became the new teachers, the new healers, spreading the influence of this Anatolian center of excellence far and wide. It was a ripple effect of healing and learning that would be felt for generations. This scene from 1309 is a powerful reminder that the quest for knowledge and the desire to heal are fundamental human drives that transcend time and culture. The principles established here combining theoretical study with practical application, treating patients with a holistic approach, and fostering an inclusive environment for learning are still the cornerstones of medical education today. What we are seeing is not just a moment from the past. It is the very root of modern medicine. The dedication, the curiosity, and the deep-seated compassion we see in this room are the same qualities that drive the best doctors and scientists of our own time. As we prepare to leave this extraordinary moment in history, let's take one last look. The surgeon is now speaking quietly to us students, answering their questions. Her expression, one of a patient and dedicated mentor. The patient is resting. The first step on the road to recovery already taken. The light from the window catches the dust motes dancing in the air. 1,000 tiny stars in this cathedral of science. It's a scene of hope, a testament to the enduring power of humanity's shared search for knowledge and healing. The work done in this room, in this hospital, laid a foundation that we are still building upon today. Thank you for joining me on this journey back to Amasya Hospital. It's incredible to uncover these hidden stories of progress and enlightenment. If you were as inspired by this as I was, do you want to forget to like this video and subscribe for more explorations into the amazing moments that have shaped our world? See you next time.